Welcome to Adapting Class. Today, we're going to talk about how to answer questions on the NCLEX using client needs. I think it's the most important information you need to know when you're approaching questions. So let's get to it. Client needs and how to identify those questions. So I'm going to use an example of some patient taking sublingual, and we're going to use each of the information, each categories of NCLEX that is usually you get graded on using that patient to go through all the stages about client needs. So let me show you. And then we're going to walk through, and I'm going to show you when you do a question, try and do the same thing. So we have a first question. The patient is a client is on sublingual nitrate. So he's on nitro, right? And this is what the report of that burning sensation under the tongue, right? When using the medication. What should the nurse tell the patient? What should the nurse tell the patient or the client? Can you identify what kind of question is this? The patient is taking a medication, burning sensation under the tongue. What are you going to tell the patient? There's so many categories of questions. Is it management of care? Is it safety, infectious control? Is it health promotion question? Is it physiological integrity? Or is it psychosocial integrity? To be able to answer this question perfectly, trying to figure out which client need it is, and then you can target it. Look at it. I'm going to show you when you're doing questions, you should do the same thing. What is the patient is on? Is on nitrate, right? Nitro. And what is the patient reporting about? Burning sensation under the tongue. And the question said, what do you tell the patient? The next thing you ask yourself is, okay, is this an expected finding of nitro? If you take nitro and you put it under your tongue, are you going to feel some burning sensation? Think about it. Is that what you learn? If that's what you learn, that means this is an expected finding of what? A medication. Therefore, this is all the NCLEX is asking you, know the medication. And if they asking you about knowing the medication, what do you think? This is a pharmacology question, right? An expected finding, and therefore this is a pharmacology. So this group go to pharmacology. Therefore, when you answering it, answer it like a pharmacology question. If you think it's a safety question, pick a safety answer choice. This is basically an expected finding of a nitro. When you put it under your tongue, it's going to burn. It's not the side effect. It's not an adverse effect. It's an expected finding. And therefore, try and pick an answer that is related to that. So what do you tell the patient? If it's unexpected, you said, oh, this is what usually will happen. Keep on taking it. You see, if you do that, you get an answer straight. There will be other options there that will trick you, but you can recognize that this is a pharmacology question. I'm doing this video because somebody asked this question. I'm trying to explain how you can use client needs to answer any question in the NCLEX. So this is the first scenario, burning sensation. So this is a pharmacology question. We're going to tell the patient an expected finding. Keep on taking your medication. Second scenario, the same patient. Now, if they tell you, right, they're having throbbing headache. Now I'm taking the nitro and I'm having throbbing headache when I take it, right? What should be the next best response? What do you think? Do the same thing. If you take nitro, are you going to have headache? If you think that is what is expected, then your teaching answer choice should be related to that. Don't tell them to do anything else unless you identify. So if you take nitro, are you going to get headache? Is it an expected finding, an adverse effect, something you got to reduce risks? It's an expected finding. Therefore, what should be your teaching? Don't tell them to stop taking it. Don't tell them to cut it into half. You just tell them this is unexpected. Then you address their need. I'm using nitro to show you all the little details NCLEX try to. If you identify what kind of question they're asking you and you put it under client needs, it will be easy. Therefore, this is also an expected finding. It's talking about a pharmacology. This is a pharmacology question. Therefore, teach the patient about the pharmacology. That's all. So therefore, what are we going to do? Pharmacology. Yeah, this is take some acetaminophen to help with your headache, but don't stop taking it. Don't cut it into half. Keep on doing that. You see 2 questions likely to get on nitro. I'm going to walk you through all the steps and possible questions they will ask you. Number 3, now the patient say what? What can you do to reduce risks of falling? If you are the nurse after taking the medication, so how can you reduce the risk of falling? What steps would you take to reduce the risk of falling? The next thing you ask yourself, falling, taking nitro, is that expected finding? Is that an adverse effect? Is there a complication? What do you think? Where would you put it? Right? Where would you put it? Are you going to put it as a pharmacology question? The patient is going to fall down, risks of falling. Therefore, what do you think? We want to prevent the patient from falling, risk reduction. Now we got to teach them about risk reduction to prevent falling. Therefore, your answer choice should be what? Reduction of risk so that they don't fall. What are you going to tell them? Right? So if you put it under, it said, this is no more a pharmacology question. It's now a risk reduction question. I don't want the patient to fall. And then what do you think? You teach them from not falling. Get up slowly. It orthostatic hypotension. Therefore, this is a risk reduction question. And therefore, your teaching should follow that. You see how same question, but I keep on changing is the scenario. It's a different thing altogether. You get the picture. Now let's go back. Number 4. If I say, how should you take the medication? Oh, no, let's change it. How should the patient store the medication? Who can tell me what kind of question is that? How should the patient store the medication? How should they keep it? If you able to find what it is, you'll be able to know, oh, what kind of teaching you should provide. How should the patient store the medication? What do you need to be able to tell the patient about how to store it? What do you think? You can put it in the comment. What do you think you need? Is a teaching fine, but teaching about what? Teaching about what? What are you teaching them? About the medication. And what medication? Is the pharmacology question again. It's just the pharmacology. So you're teaching them about what? The pharmacology of the medication. Therefore, this is a pharm question. Therefore, teach them that, oh, you should not expose it to sunlight. Don't leave it in your glove compartment. Make sure you keep it in the light, in darkness, and stay in the same bottle. And then you'll be able to choose right answer. You don't change it. You say, oh, this is about pharmacology. What do I know about nitrate? I shouldn't expose this to sunlight. Boom, you pick an answer. That's all. If you do that, if you see a question, go through all these 4 steps. And then you'll be able to figure out. Now, I'm going to change it. Number 5. Patient now said what? Take the medication. He has chest pain 5 minutes after taking the medication. You see what I'm doing? 5 minutes after taking the medication, patient still has chest pain. What do you think? What do you think is going on now? Is this what you should expect? How would you classify it? What do you think if you're taking care of this patient? A, he's taking nitro, he still has chest pain 5 minutes. What situation are we now? Am I talking about a pharmacology question? Am I talking about what? Risk reduction? Am I talking about what? Safety? What are you talking about? What do you think? If they still have chest pain, what do you think? What should be the first thing that you should worry about? Remember, we're talking about client needs. So somebody taking nitro, they still has chest pain and it's not going away. How would you classify it? Think about it. This is maybe what? MI. It's no more a pharmacology. It's not the way the medication works. That means the medication is not working. Therefore, it's not the pharmacology question. It's about what? This can be heart attack. And if this is heart attack, what are you going to do? Right? You need to act right now. We need to do something right now to prevent heart attack. Which portion of the NCLEX, when you see emergency, you got to act right now? It's a priority. What do you call it? Physiological adaptation. The patient condition has changed and I need to do something right now. Right now is called physiological adaptation. So do something. So this is a physiological adaptation question. And then you can tell them to take another one and call 911 right away, right? This is the way you can think about. Now the patient condition has changed. So this is a physiological adaptation question. Identify it and then you can answer it. Physiological adaptation question are emergency and the prioritization question. Learn how to use these if client needs and you'll be able to answer any question. Now let's go to number 6. Which teaching prevent angina, right? Attack when you're on nitro. So which teaching will prevent, if this is the question, you see this question, so which teaching will prevent the angina when you're taking nitro? What do you think is that? If you see this question, they say patient is taking nitro, what teaching will you give them to prevent what? Heart attack. How would you classify it? I want you to classify it. Think about it. I'm going to teach the patient. Is it a risk reduction? Risk reduction is you preventing something, right? This is not preventing. We're teaching them to what? When they're taking the medication to what? Not to have angina, right? Which teaching will angina will you basically prevent angina when you're taking this medication? This is a health promotion. You're teaching them things to do. First, preventive measures. All preventive measures that we do when you see that kind of question, this is health promotion. So this is health promotion question. So I'm showing you all the way the NCLEX set the question so that you can figure out, like when you see your question, you can figure out that, oh, this is health promotion. Therefore, it's about the patient primary prevention to prevent further so that they don't have a heart attack. Number 7. This one is easy. Patient express fear of having angina. Where is this? What kind of question is this now? If you know this is a particular question, then you can teach them. You can pick your right answer. What do you think? If I fear of having angina, how would you classify this? What kind of client needs are we talking about? Is this physiological adaptation, risk reduction? Is it a safety question? Is it management of care? What do you think? Fear, the word fear means it's psychological. So this is a psychological question. So you can teach them about coping and the things to worry about. They are all teaching, but you got to put it under specific client needs. This is psychological. So psychosocial integrity question. So when you're answering it, you answer, you pick an answer that really, really represent what? Psychosocial integrity. When they set the question, they will put different kind of answers. Each answer choice can be put under client needs. And then you can have to figure out where they fall. Therefore, if they tell you they are afraid of having heart attack or angina, chest pain, I'm going to pick an answer choice that talk about what? Psychosocial, because of the word fear there. Now, 8, look at it. This one, I know you can figure it out, right? Safe handling of what? You're teaching them about safe handling of nitro ointment. Is he talking about the medication? Is it pharmacology question? Risk reduction question? Or safety? This is classic safety question. You know, if you don't dispose it well, the ointment, you can absorb it and it cause problem. So this is a safety question. Therefore, teach them what kind of safety teaching would you provide in this situation? You need to wear gloves, dispose it appropriately. So client needs are your best friend to answer questions if you're having problem. Go through his answer choice and say, hey, what is going on with this patient? How can I put it in the right place? And now I will be able to answer the question. Did you see this is the way you can figure out? And then this one is the same thing. Look at it. Which medication you should avoid when on nitro, right? This is a safe use of the medication. When you're on nitro, there has to be some safe use. The safe use is you should not take anything with it. That is also nitro. It's not the risk reduction, right? It's not, right? Risk reduction, something is happening. Remember, you can't confuse them. Something is happening already, and we want to prevent it from going further. That's risk reduction. If it became an emergency, it's a physiological adaptation because your condition has changed. When you're trying to prevent the whole thing from happening and you know you want to provide some safety, it becomes a safety issue. When you're providing preventive measures, teaching is what? Health promotion. Every question, you can put it in the right way. Therefore, they should avoid fears. And that's what you teach them. That's what you teach them. Now, which one is this? I want everybody, if you're watching, put the answer choice in the comment. When should you take the nitro? When should the client take nitro? When? What kind of question do you think this is it? When should you take nitro? To be able to know that, you got to know what you're dealing with. When can I take the nitro? I know you will say teaching, but what is the question asking? Which client needs? Remember, you're getting graded on client needs. You're getting graded on safety. You're getting graded on physiological adaptation. You have to understand those language so that each question you have to see it in that eyes that, oh, they're asking me about health promotion. This is why they send you your CPR and you can't figure out about it. You can't figure it out. Why did I do that? Somebody said chest pain. Yeah, you take it to prevent chest pain and other things. You take it what? During, before you have symptoms, or around and as schedule, right? You taking it before or during chest pain. And this is how, because it will work right away. This is a pharmacological question. And that's how you can teach them. You take it during that time. And your grade will be based on what you're telling them, because there's some questions that has higher points, like physiological adaptation question and safety questions, you get more points. And so because of that, you have to be able to identify what kind of question you have and which group of clients needs we're dealing with. This one is a trap, but it's not. I want you to think about it. The client report what? Flushing and dizziness after the medication. What would you do? You have to pick an answer choice. There will be multiple choices there. Where would you put this thing? A report flushing and dizziness after the medication. Which client need do you think is happening here? It's an expected finding, good. But which client needs? Where will you put it now? You can't tell the patient, hey, deal with it, right? He said flushing and dizziness. You have to tell them something. But which client needs? You have to identify the client needs, then you can provide the appropriate answer. I don't think this is risk reduction because they know this is an expected finding. So therefore, they don't going to get into trouble, right? Dizziness and flushing is what? Is a expected finding. This become what? A little bit of side effect, but it's not completely, right? It's part of it, but you can't leave this patient alone. This is what we call basic care and comfort. You got to reduce this discomfort the patient is having. And so this, you see, fall under basic care, right? And comfort. Now you see the picture, right? This is the way they said all these questions they can give you. When you're taking the test and you see one question and they keep on repeating it, they're testing your knowledge on each level of client need. This patient is not the same as the risk reduction question we saw on the pharmacology question about orthostatic and trying to fall down. It said preventive. You see, the language in the question will tell you. I said, patient report that. What do you tell them? When you telling them something, now you're reassuring them, but you have to deal with the discomfort, and this becomes basic care and comfort. Now, same thing. If they tell you dry mouth after using the medication, this is the same thing. This is, you got to deal with the dry mouth, right? Dry mouth. You got to help them deal with the dry mouth. So you got to provide some basic care and comfort. Tell them to sip a little bit of water after taking the medication to help with that. Now we left with two more. The two biggest ones that they can ask you about, right? What do you think? The two biggest one, and it's management of care. What do you think they will frame the question? How would they frame the question in terms of management of care? So this is management of care. This is where prioritization come in, or delegation and assignment come in. So this may be like, who do you see first? So you have a bunch of patients who are on nitro. One probably is taking sildenafil. One is also having, he has flushing in his face. One, right, may have some dizziness a little bit. One is a little bit orthostatic or headache. Then you have to know, who do you see first? The person you see first is the one you have a problem with. That is going to get into trouble. So management of care question will be basically, who do you see first among patients taking nitro and other things? And the last one is delegation. Delegation question, it can actually the same thing. It will be related to what? The RN delegating, teaching to what? LPN for a patient who is taking nitro. And then you have to intervene and say, no, you cannot do that. And as you can see, there's each question can go through, one thing can go through different stages of client need. And then I'll recap and so that you can figure it out. I want you to like sit down, take a question, try to change it in different form, and then see what they're doing to you. Or take go and take a cue bank or something like that, and look at the question, the way they frame it. And you can figure out, is he a safety question? Is he a risk reduction, physiological adaptation? You want to understand that. And I want you to pay attention. That is why I start doing these 85 questions, so that you can see the different kind of questions. Same thing, but the way it's framed, you have to answer it based on the need of the client. Don't let the NCLEX take those points from you. If you don't approach it that way, you may know the answer, because by answering the need for that particular question. Each question has specific requirement. So we talk about the patient who is taking nitro, and he has burning sensation under the tongue. And we talk about it, and I told you that one is basically an expected finding. That's the pharmacology question. Now, when he complains about throbbing headache, it's the same thing, pharmacology question. So teach them that, hey, this is what is expected, but I want you to take this. It can also be basic care and comfort, but this specifically is that. If they're falling down, hey, you got to prevent further falling. That's risk reduction, right? That's the key. And then if they stay as chest pain, you don't want them to die. That's physiological adaptation, because their condition has changed and we want to do something now. You let them call 911 and take another dose. And then if you tell them how to prevent further angina, reduce your stress, right? That's health promotion. You're promoting their health. And you tell them, hey, if they tell you they're afraid of getting heart attack, that's psychosocial. You have to teach them and then be therapeutic in your answer choice. You see? How about safe handling of the medication? It's safety, right? How about keeping it in a dark place? That is also safety, teaching them about things they need to do. And then the management of care is about delegation and assignment. Remember, every question you will see, there's a way you can figure out where you belong to. Try to put it in the group, not isolated. And then when you're picking the answer choice, think about it. Oh, this is a risk reduction question. Therefore, I should do what? Prevent further injury to the patient. If he is a physiological adaptation question, then I need to act now. Now, let me give you a trick. If you're trying to pass this NCLEX, look, 50 to 60% of your test is all physiological integrity. I call it the PI. Why? Because he has basic care and comfort. What else does he have? He has pharmacology in it. He has risk reduction. And what he has physiological adaptation. So this is a very, very important. This group, if you're trying to pass the NCLEX and you're having issue, I want you to put your 80% here first. And make sure you know your basic care and comfort. Pain, patient. I mean, that is the basic thing the nurse do. Mostly, that's what you do. Make sure the patient is okay when you're in the hospital, at home, right? The pharmacology, of course. I have a bunch of farm videos I did. You can watch them and watch them as much as you can so that you know them. Then risk reduction is you have to understand that something bad is happening, right? And you want to prevent it further. Unfortunately, risk reduction and physiological adaptation message is big. So those are all they deal with med surgical. Physiological adaptation is a bunch of prioritization, and then emergencies, all the emergencies, strokes, burn, all those things, IV fluid, endocrine fall under that. Try to know the composition and then focus on those areas. I want you to spend more time on this. 50 to 60% of your test is here. If you master that, you're halfway through. And then the rest, you just try to get a health promotion and then case study. You'll be fine, right? You'll be fine. Case study, and health promotion, which is maternity and peds, and then infectious control. I don't think you can make it if you score low. Look at your CPR and then look at it carefully and see if this is you've taken it before. See what is your score under basic care and comfort, pharmacology, risk reduction, and physiological adaptation. If you get only one above passing, I don't think you can make it. You need at least maybe three above passing in this group because it's 50 to 60%, right, of your test. Therefore, 85 questions, calculate. If they give you 85 questions, more than half of it is coming from here. More than half is coming from this category. I decided to do this video to get people passing. They didn't know. You have to know how to approach the test, right? You don't know which one to study, spend some time here. But not only that one, but make sure you golden here. Golden. Once again, golden. This is Adapt NCLEX. Thank you for watching. Go back to your client needs, look at your CPR, and see basic care and comfort, pharmacology, risk reduction, and physiological adaptation. They all fall under physiological integrity. I know when we do videos, we don't follow on the client needs, but you also, when you study, try to go into the client needs and say, hey, where am I lacking? And fill in the gap. This is what will get you there. Thank you and have a good day. Good luck in your exams. As always, keep charging. And if this video helped you, subscribe to Adapt NCLEX and get more content like that. Good luck. Bye.